Celiac disease is also known as gluten sensitive enteropathy or celiac sprue. It's one of the more common GI disorders that we see in our field. And it is an immune response to gluten, which is wheat, rye, and barley, and the effects on the small intestine, which is the part of the anatomy that absorbs your nutrition and your nutrients. The diagnostic gold standard is something called an endoscopy, with a biopsy of the small intestine, which diagnoses an abnormality of the small intestines. And this is what most people will ultimately undergo to confirm the diagnosis of celiac disease. Well, there are many symptoms of celiac disease, some subtle, like anything else, as a spectrum. So diarrhea and bloating are probably the number one symptoms. People can get loss of weight, they get fatigue, and they can get anemic. In adults, there are some side effects such as malabsorption of nutrients and vitamins that can cause osteopenia and osteoporosis. And there are often skin disorders that are associated, something called dermatitis herpetiformis, which is a rash. If you have any of these symptoms, you should see your primary care physician or probably better yet, a gastroenterologist. Gluten sensitivity is a real thing. We have many patients who probably fit under the category of irritable bowel syndrome, or even those patients who have Crohn's or colitis who are gluten sensitive. And that may be more of a spectrum. It may not be an absolute that you need to be completely gluten-free. We have the only celiac center in the state of New Jersey, based right here in Livingston, New Jersey, affiliated with RWJBarnabas. And we have a wonderful nutritionist and dietitian, Michelle Pasha, who does amazing work with most of our patients, including educating them as to how to live a gluten-free life, how to cook, how to shop, and she even educates restaurants and other facilities on how to prepare foods in a gluten-free way.